Cancer, it's a diagnosis that over 500 Canadians receive every day. And even though we've come a long ways in treating cancer, we still have a lot of room for improvement. Many patients develop resistance to current therapies, allowing their tumors to continue to grow. Or they suffer with severe toxicities that limit their treatment options. And what we've been working on is to try and design a virus that can treat cancer. So you may be wondering, how do you take a virus that typically makes you sick and turn it into a cancer-killing machine? We've been working with vaccinia virus, which you may know as the curative agent of smallpox. And we've engineered it in such a way that it takes advantage of the unique environment of a tumor for selective replication and tumor killing. So in normal cells, you have low levels of dNTPs, or DNA building blocks. And this is because normal cells are not growing and they don't need a lot of these, but our virus is dependent on them for its replication. Because of this, the virus doesn't replicate, leaves normal cells unharmed. But in cancer cells, they're rapidly growing. They have lots of the DNA building blocks around that the virus can harness to replicate and ultimately kill the cancer cell. An example of this is shown here in patient tissue, where you see in the tumor there's a red signal indicating virus replication. But in the normal tissue, there is none. And this shows the highly selective nature of our virus. So how does a selective replication result in clearance of the tumor? So when you get the virus infection, you get the killing from the replication, but you also start destroying the tumor blood supply. This starves the tumor of nutrients it's needed for growth. But along with that, you also start breaking off pieces of the tumor cells that can be taken up by your immune system, where they recognize them as foreign because of the genetic mutations in cancer. And this starts a cascade of immune activation that generates tumor-killing immune cells. And these immune cells can traffic throughout your entire body to find and kill distant tumor cells. And this cycle can continue with virus replication and immune cell activation. And all of this ultimately results in reduction in tumor size. And this is shown here in a preclinical model we use in the laboratory. And to highlight this replication of the virus, this video here highlights one cell being infected with a virus and it rapidly spreading to infect hundreds of cells in a very short amount of time. And it's these unique features of both viruses and the engineering we've done to the virus that allow for a tumor-selective virus that is extremely safe, non-toxic, and is able to overcome resistance generated by many other therapies. And with this, we think that viruses can be used to safely, effectively treat many of the cancers that have limited treatment options and can provide an excellent source for cancer therapy in the future. Thank you.